So now, I will be demonstrating the vital signs. Vital signs are physiologic measurements of the neurologic, metabolic, respiratory, hormonal, and cardiovascular status of the body. They include body temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. These measurements are of utmost importance because they are the basis for identifying physiologic disturbance or even life-threatening health conditions. Thus, vital signs are monitored periodically. So the first thing we do in assessing vital signs is to greet the client, introduce yourself, and verify the client's identity. So, good day ma'am. I am Jaira Umupang, your student nurse. So, may I verify your name and your birthday?
Tyra Reyes, March 26, 2002.
So, after asking the client, we need to wash our hands and sanitize before doing the procedures. We need to close the curtains. Alright ma'am, so now I'll be taking your vital signs. Ensure that the client is calm and quiet. Ask what the client did for past 12 minutes. If patient was engaged in strenuous activity, allow 10 to 15 minutes to rest. Ma'am, can I ask what you did for the past 12 minutes?
I'm just sitting in my bedroom.
Alright. Okay ma'am, thank you. So for today, I will be checking your vital signs. It is important for us to know your vital signs if there is any problem with your health conditions. So the vital signs is consist of 4 elements: the body temperature, pulse rate, respiratory rate, and the blood pressure. Expose the patient axilla by securely folding the client's shirt sleeve or grown up to the deltoid region. If axilla is moist, dry it with the patient's towel using patting motion. Ma'am, is it okay if I fold your shirt up?
It's okay.
Thank you. Remove the thermometer from the container. With a cotton ball, wipe the thermometer in a rotating motion from the temperature sensor to the neck. Place the thermometer in the center of the patient's axilla. Assist the patient to place the arm tightly across the abdomen to keep the thermometer in place. So sir, I will be checking your temperature. Wait until the thermometer will pass.
Oh, perfect destination.
So ma'am, your temperature is 35.9 degrees Celsius. Note, remain holding the thermometer in the place if the client is irrational or very young. So now, I will be assessing the client's peripheral pulse. First is to assess the client to a comfortable supine position or to a sitting position on a chair or at the edge of the bed. Can you please take a seat here, ma'am? Okay. So now we will select the pulse point. Normally, by the radial pulse is taken. Place 2 or 3 fingertips, index, middle, or ring, lightly, squarely over the pulse point. Never use the thumb in assessing the pulse. Okay, sir. So now I will be taking your pulse rate. So, rest the arm in 90 degrees. Sir, okay, ma'am. Now I am going to take your pulse rate. So, we will need to rest your arm in 90-degree angle across the abdomen with palm facing downward. observe the first minute, the regulatory of the pulse. Count for 1 full minute. After the 1 full minute, note the pulse rhythm and the volume. So, in assessing the respiratory rate, the first thing we do is to feel the rise and fall of the diaphragm while supposedly taking the radial pulse. So, it has only the same procedure with the pulse rate. And now count the respiratory rate in 60 seconds. One inhalation and exhalation are counted as one cycle.
3.
When the abnormal breathing pattern is noted, use the next 60 seconds to carefully observe the characteristic of the client's respirations. And after taking the respiratory rate, note the rate, depth, rhythm, and character of the respiration. Refer any abnormal findings or any complaints of the clients. Now, we will going to assess the blood pressure of the patient. First, position the client appropriately and allow 10 to 15 minutes rest. If the patient is engaged in strenuous activity before the BP assessment, in a lying position with arms at side, palm facing up, and in a sitting position with arms slightly flexed and the forearm supported the heart level and facing up. Fold the patient's shirt sleeves or grown up to the shoulder, making it sure it is secured and it will not fall for the brachial area. Ask the client not to speak when the BP is being measured. Smoothly and evenly apply the cuff with its lower border located about 2 to 5 cm above the antecubital space. Ensure that the tube is placed in line with the brachial artery. Measure if the cuff is snugly fitted by inserting 2 fingers into the BP cuff. Position oneself so that the manometer were vertically at the eye level. Observation should not be farther than 1 minute, approximately 1 yard away. Insert the earpiece of the stethoscope in your ear so that they tilt slightly forward. Be sure sounds are clear, not muffled. Ensure that the stethoscope hangs freely and it is not contact with any object. Warm the diaphragm of the stethoscope. Locate the brachial artery and place the diaphragm of the stethoscope over the brachial pulse. Secure the chest piece by placing over the palm of the non-dominant hand over it. Close the valve of the pressure valve clockwise until it is tight. Quickly inflate the cuff until the last sound. slowly. Release, open the pressure valve and allow the manometer gauge to fall at a rate 2 to 3 mmHg per second. Note the point of manometer where the first clear sound is heard. The sound will slowly increase in intensity. Continue to deflate the cuff, noting the point at which sound disappears. Listen for 10 to 20 mmHg after the last sound. Then allow remaining air to escape quickly. Remove the cuff from the client's arm and assist the patient to assume a comfortable position. Cover the upper arm if it was previously clothed. Report any alteration